PA Patsy Colvin here from Refreshed by Dr. Monica, where we get COVID tested once a week. Mine was negative this morning, and take our temperatures every day. So we're very conscious of infection control. And I think I'm safe to talk to Daylin without my mask on for the purposes of this video. Today we're going to talk about the Radiesse jawline treatment, one of our very best treatments. The first thing we want to do is we want to evaluate the contours of our patient's face. We want to look and see if there's volume loss in the upper face, because oftentimes that is the culprit when there's jowling. So if that's the case, the face loses volume here, it pushes the skin forward here and down like this. So sometimes one of the first steps of treating the jawline is to treat the upper face. And then we can treat the jawline for definition. In a woman, we want to have the well-defined jawline like Queen Nefertiti, kind of our ideal for the jawline. In a man, we're looking for angularity. So we actually use different injection techniques for men than we do for women, because for women we're going for softness and definition. For men, we want that masculine look, which is a more angular look. They have a different bone structure, so we treat them differently. Men love this treatment, by the way. I want to let you know, Daylin, can you tell me, why is it that you would like to have the jawline treatment today?
I think I used to have a very defined jawline in my younger days, and I think over time it's gone, and it's now with age I have a jowl that I'm not happy with.
And that is one of the most common complaints I hear probably several times a day with my patients, with my women patients. So, and the younger patients, they may not have age-related jowls, but they oftentimes want more defined contours. So even in my young patients, if they weren't blessed with curved cheeks, they'd like to have them, and if they didn't get a naturally well-defined jawline, they would like to come in and have that done, and we can do that. Okay. So let me tell you a little bit about Radiesse. It's calcium hydroxyapatite. It's a calcium, and which is actually found in bone, and it's a biostimulatory. So when we inject it, it doesn't just act as a filler, it stimulates the surrounding tissue and collagen and your own tissues, so that it leaves long-term collagen when it dissolves. This treatment will last 12 to 18 months. And Radiesse is not just for use in the jawline, it can also be used in other parts of the body. One of our favorites is the Hyperdilute Radiesse treatment, which can be used in the neck and the thin skin of the décolleté. And again, it stimulates long-term collagen, and it is a biostimulator. The number of treatments you need, it depends on what you're going for. It may take you up to 3 treatments to get a buildup of long-term collagen. The gala special today is to buy 1 syringe of Radiesse and get 1 half off. So a regular syringe of Radiesse costs $1,000. It's a long-term treatment. And so in this special, you get 2 syringes for $14.99. You save $501. Radiesse comes in a 1.5 cc syringe too. All the other fillers come in a 1 cc syringe, so you actually get half again as much for the price as you would in any other treatment with a filler. So let's get started. Here at Refresh, the injectors train continuously. We always have another training session on the books. So we use the cannula technique, and this is a very safe and efficient technique. I'm going to start in the preauricular area, the area above, above the ear, and come down to the angle of the jaw, right here. That is the place that we are aiming for. So I'm going to make a little deposit right here at the angle of the jaw. And then we're going to do some defining in front of the ear. So when we're treating the jaw, one of the ways to treat a jowl is to pull back in this direction and forward in this direction. And this treatment is going to entail both of those. Okay, so turn your face a little bit like that. Of course, this treatment is individualized for each person who's having it. Some people have this thing, some people have that thing. So we
Oh yeah, different.
yeah.
Very different, yeah.
So she's halfway done, and she's looking at where there used to be a jowl, and now it's not.
Yeah.
There's nice definition, and as we were talking about, over a period of 2 to 3 weeks, it settles into the tissues and takes the form that it's going to have for the next few years. So it's called the tissue accommodation response. Like buying a new pair of jeans and waiting until it actually fits your body, right? It takes a little bit of time as it settles into your tissues and takes its final shape. Until the time it feels a little lumpy, a little bumpy, not like it's really going to feel over the long term. Now we're going to do the other side. Right, second side. Are you happy so far?
Very happy.
I am too, I love it. It looks great. Okay, give us a smile. Turn and give us a smile. Can you see the difference in this side from this side? Everything's lifted here. Okay, let's do it. Radiesse jawline treatment.